So we are live. Good morning, good afternoon, good evening again. Thank you so much for joining us. So once again, I'm Meg. I'm part of the social media team here at Fix. We're joined today by Dr. Keith Overland and Eric Fernandez from Hyperice. So last week we introduced you to Hyperice and the Hypervolt Plus. This week we're actually going to be doing a product demonstration, so really practical, keeping it very practical for how you can use the percussion massage device in your own practice. Eric's going to be taking us through the different applicator heads. Keith is going to be talking about how and actually showing us how he uses it in his own practice. So without further ado, we'll kick off with Eric. If you are watching us and joining us live, say hello, leave us a comment, ask questions. We're here live for the next 10 to 15 minutes. We'll be answering your comments live. And as always, this video will stay permanently on both YouTube and Facebook. So feel free to comment afterwards, and a member from the Fix team will comment and reply to your questions. So say hello and let us know where you're joining us from. Eric, will pass over to you and kickstart with practical product demonstration of the Hypervolt Plus.
Great. Thank you, everybody, for joining us again. Excited to get a chance to continue the education story. As Meg mentioned, I'm just going to share a few of the features and sort of how people commonly use the different applicator heads on the Hypervolt to try to provide a little bit more understanding of the product, and then turn it over to Dr. Overland for that practical demonstration. So if you've looked online or used the Hypervolt, you know that it comes with 5 applicator heads. I'm currently showing you the ball head, which is sort of the default go-to treat anything head that folks usually get used to. It's a great way to get started, really treat any area of the body, really, really straightforward to use. But there's a lot of other great applicator heads that I'd like to show you, because I think sometimes they get overlooked, or certainly we get a lot of questions on how and where to use them. So the first one that I want to show you is what we call our cushion head attachment. And so the cushion head attachment, as you can imagine from the name, is really designed to lessen the impact of the percussion a little bit, or at least soften the experience for the patient. So I wouldn't say that it takes away from the benefits, but for folks who either have heightened pain sensitivity, are just nervous about percussion therapy, or if you're treating near the body where there's a lot of bony prominence, for example, around the base of the neck, I know is a good example. The cushion head attachment can be a great way to get started. So definitely a really important one. Another one that may seem pretty obvious, but I'm going to cover it, is our fork attachment. The fork attachment, as you can see, really is going to hit the body, impact, and percuss the body in 2 different spots at the same time. Phenomenal for the gastroc and the calves as a whole, but also for working up and down the spine, can sort of save you time from treating on both sides. And a lot of folks will use it to really go up and down the spine. But again, a lot of great applications here with the fork attachment. The flathead attachment, which I do believe Dr. Overland is going to be showing you a little bit later, is really phenomenal for getting that increased and maximum surface area. So when you are utilizing the Hypervolt on perhaps your larger muscle groups, I'm thinking about your hamstrings or your quads, but certainly there's other areas where they'd be applicable. Your calves are great as well. Really any place you want to get that larger surface area to really accelerate the benefits of that percussion therapy, and again, just really be able to impact a larger area and maybe move a little bit faster. And then finally, I want to call attention to the bullet head attachment, which this might be the most straightforward, yet also very often underutilized. Trigger point release all day long, going to be really, really phenomenal, give you a very, very targeted application. Regardless of which head attachment you use, they all have their benefits and their place, but really they can all be used anywhere on the body that you're treating soft tissue limitations. And again, if we just go back to percussion therapy briefly and think about the benefits of percussion therapy and what we're actually impacting on the body, right? I mean, at a very high level, what we're doing is very rapidly, right, compressing and expanding those micro layers of your fascia. And what the Hypervolt has been shown to be highly effective at is rapidly warming up the area, warming up the soft tissue, decreasing fluid viscosity, right, increasing fluid cloud. And that has a lot of benefits for stimulating that microcirculation, for loosening up the soft tissue and the muscle. There's absolutely, that neurophysiological effect, which many of you may have experienced if you've used our product in terms of desensitizing the tissue. So That's another great application if you're going to be doing a lot of manual therapy and people have heightened pain sensitivity, or you feel like the tissue is really hard. You know, if you're trying to diagnose, for example, like the tensions, right, or the defects, or the movement, right, the tension and the texture of the tissue, for example, you know, using the Hypervolt to start is going to make that job of diagnosing and treating often a lot easier for you and save your hands. I want to call attention to a couple things. Lastly, before I turn this over, the device has 3 frequencies that it treats at. And when you turn the device on, you go ahead and select that frequency by cycling through the button right on the back. The frequencies are going to be anywhere from 30, 40 to 53 hertz. Now, most of the research that you may have seen or that you'll find on percussion therapy is usually done in the 50 to 53 hertz range. So I will say that some of our clinical partners report that, you know, the highest setting, some patients, it tends to get a little intense. But that really is, from what the research has shown us, the best frequency to use the device on. And again, I'm speaking high level, right? Every patient, every body, everyone's physiology is a little bit different, and every need and injury is different. But something you can consider doing is starting at a low frequency and working up throughout the treatment, because again, that neurophysiological effect and that effect of desensitizing the tissue is going to work in your favor. So I wanted to pass that on. And the last thing I'll say before I turn it over is, when you do first turn the device on, okay, you will notice that when you start it, you'll notice that those 3 lights in the back start blinking. And they're going to blink 5 times, and that's the device calibrating, the pressure sensor in the device calibrating. Once it's calibrated and stopped blinking, and you start applying the device, find my camera, you'll notice that those lights on the back light up at different levels, depending on how much pressure you apply to the body. So that feature was designed specifically based off the feedback we got from our chiropractic and rehab partners, understanding that when you lose that physical touch, right, that tactile, that physical response you get using your hands, that, you know, you want to have some sense of how much pressure you're applying, whether it's you want to apply even a pressure across the entire area, or there's areas you really want to be able to know that you're affecting greater pressure and have some control. So that's a little bit about the applicator heads, some things to consider when using it in terms of those frequencies, and also utilizing that pressure sensor. So I'm going to stop, and I would love to, I believe, turn it over to Dr. Overland for the practical demonstration.
Eric,
Fantastic. So,
oh, go ahead. Go ahead, Meg.
no, I was going to say fantastic. So, Dr. Overland, you use the Hypervolt Plus in your practice, and you've set up a room specifically to show us in practice how to use it. So, yeah, kick over to you.
Thanks. Didn't mean to jump the gun there. So, thank you, and thank everyone for participating. This is something new that Fix is engaged in. We hope you're enjoying it. We do look forward to your comments, because we only do better. Combination information. Some of you may know I'm the Secretary General for Fix now for the past several months, and we brought Hyperice in. They've got multiple products as a partner. We're looking to build toolboxes for you all to be able to use and to understand, and through education, through clinical utilization, whether we're at an event or whether we're in our office. Unfortunately, recently, most of us are in our office. So what I'm going to do is show you a couple of clinical applications. So since we're in my clinic, I'm having someone grab my camera. So we got to make sure that we're aiming. And so you won't see me as much, but you will hear me, I hope. And I'm putting my mask on. We have in our area, pretty important to do that. And so I'm doing that as I'm with our patient. So hopefully you can hear me. Now I'm going to use 3 different attachments, the flat one, the bullet one for trigger points, and then the round one for 2 different conditions. One of the conditions that we're going to talk about is I'm just going to use tennis sort of as a theme, since that's what I really enjoy myself, and we see a lot of this. It's something called tennis leg. If those of you don't know what tennis leg is by that term, it's usually a strain of the gastrus medialis, the medial aspect of the gastrus. So what we do first is we turn the Hyperice on to the lower level. You can see over here, And then we're going to go along the gastrocnemius to feel, excuse me, walk around the side. We're going to walk around to feel the medial gastrocnemius through the sensation. Most of us are very good at manual therapy, and we can determine sometimes those muscular fixations, dense fibers, trigger points. And so when somebody has a pull, has a strain, you're going to notice them. So what I'm looking here for through this is, number one, almost a warming up, getting the blood flow going, getting the patient used to the sensation. And right here we have a really tight knot that I'm feeling. And you all know what I'm talking about, that different sensation, that different density. So I will go for about a minute just to work the entire medial gastrocnemius. And then I will kind of bring it up right to the insertions and the origins. And my goal here is to, number one, focus on the muscle tissue. We want to make sure we keep off of bone. Bone is not very receptive to this vibration. We want to make sure that it's about 30 seconds when you find a particular trigger point or not. We're looking for about 30 seconds, so it's not minutes. Then what I do after this is I turn this off, and I'm going to switch the heads to the trigger point head. The trigger point head is much more specific, looks like a bullet. And I put this on. And now what we're going to do is put it on as well. I like to use the second speed on this, and I'm going up. And what I'm going to do, since we're very good with our hands as well, is I'm going to go up here, but I'm also going to feel for that spot, so I know exactly where I'm going to be. And I'm going to bring it onto that trigger point, and we're going to focus very much. Now, I'm sure Kate is not very happy with me right now, because when you have a trigger point in a muscle, it is really quite tender. So it's very important that we communicate, we change the settings, we change the depth, and we look at those 3 lights to look at our compression. So we work on this, and in my opinion, this saves our hands. This allows me to get much deeper, much more accurate in those trigger points throughout the body. And it's very simple to use, and patients love it. They find it is so effective and has incredible clinical results. So we do that for about 30 seconds. I've done a little bit more now. Then we take that off, and I'm going to normally do some palpation, and I will do some pin and stretch as well. I will also be doing some work for flexibility, stretching. I will be talking to this patient about eccentric loading to try to help facilitate the healing and the strength and the recovery. And most likely we'll put some tape on, whether it's a dynamic tape that Fix is working with very closely, or whether it's a rock tape or KT tape, one of those types of functional tapes as well. And so if I can have you just turn over 1 second, Kate. The last thing I'm going to show you very quickly, just because we have her here, and I wanted to show the third one is for shin splints. Again, we're using just lower body right now. So most of the time, shin splint is going to be the posterior tibialis muscle. We're going to palpate it. You can use the flat head, but just for time, I'm going to palpate. And we're going to look. We've all felt those nodules. We've all felt those dense fibers right here. Medial aspect, very common. So the round head, I put at 2 dots, get good motion, and very gently, we're bringing this just up right on the medial aspect. We're not hitting the tibia, not comfortable, but we're doing the medial aspect right into where that tight, dense tissue is. This does not replace functional work, dynamic work, strength work, but is an incredibly effective tool in the box that is portable and very, very simple to use. And we do this for about 2 minutes, very specific into the region. Again, add on, in my case, what I like is eccentric loading. add on taping, look at shoes, look at foot mechanics, look at knee mechanics. And most of the time we strengthen those anterior leg muscles and we get rid of shin splints. So with that, don't want to use all of our time, but I want to thank you. I want to thank our foot model, Kate, and our cameraman, Sydney. And I want to thank you for letting me spend a little bit of time and having you join me in my clinic. So Eric, back to you a little bit, and Megan.
Fantastic. Thank you so much, Keith, for that demonstration. So I've included a photo here of when you do purchase the Hypervolt Plus. So the difference too, for anybody wondering, the difference too between the silver Hypervolt and the black Hypervolt is that the silver Hypervolt, Eric, correct me here if I'm wrong, but the silver Hypervolt is the Hypervolt, which is the basic product. The Hypervolt Plus is the black premium version, which has 30% more power. And what's included when you purchase this, it comes with the 5 applicator heads that Eric walked us through earlier and that Keith just walked us through then in practice. You have the Hypervolt head attachment set. It's a Bluetooth-enabled device. It comes with the pouch and it also comes with the wall charger. And yeah, so that was a product demonstration. Thank you, everybody, for joining us. As we have 1 day left in our giveaway because we are giving this product away. So 1 day left. The details are here on the screen. You take a photo of yourself being active in your practice and then enter the URL of that Facebook post in our entry form. So 1 day left. Entries close on the 30th of October. It's a fantastic device, as you've just seen. Any closing comments or remarks from Eric or Keith?
Just very quickly, just so you know, very shortly, Fix will be putting out a promotional code for you to use to be able to purchase these products like I have done at a good discounted price. We'll be doing that very shortly. So if it's something you're interested in, Fix is going to help you access it much easier. But thank you, and Eric, thank you, and thank you, Meg. Eric, any last thoughts?
No, thank you everybody so much for the time. I know there's only so much we can cover in these, but I think these are so helpful. And if nothing else, hope that they spark some conversation between all of you tuning in and your peers. Additional questions, things that come up, please comment, please leave them on this video. I know they'll get routed back to Dr. Overland or myself or whoever is appropriate. Reach out anytime. We love talking about this stuff and hopefully it was helpful. So thank you so much.
Fantastic. Thank you so much, everybody. And we'll be running more live sessions in the coming weeks. So we will see you then.